Welcome back. Thanks for joining me back again in my Helicobacter pylori series. It's Eric Backer, naturopath from New Zealand and author of Candida Crusher and formulator of the Candida range of products. We're going to do another video today called What are the risks if H. pylori is left untreated. So the risk factors really depends on you. It depends on how you're experiencing your infection. Do you have a mild case? Do you have a moderate case? It depends a lot on your current diet and lifestyle. Are you smoking tobacco? Are you drinking alcohol all the time? Are you eating crappy foods? Are you eating a lot of takeaway food? Are you living a high-stress life? Are you taking lots of medications? Are you ignoring health in general and just living a life full of, whatever, booze and I don't know what you do out there? You get my point? If you're a person who's living a healthy life, a person who's getting plenty of sleep, a person who's trying to eat a good, healthy, whole foods diet, a person who exercises regularly, a person who understands that smoking is the most stupid thing you can do. When you start living like that, the chances are you're going to overcome the infection much faster than a person who's not living like that. The risks will always increase with any kind of condition with a person who doesn't take their health seriously. One of my favourite sayings has always been, if you don't take your health seriously, you should take it somewhere else. And that's what I think all doctors should tell their patients. If you don't give a damn about your health, then the doctor shouldn't give a damn about you. Then you are left to your own devices. I could never understand why years ago they had people in hospitals smoking tobacco, cigarettes, and they'd actually wheel them out of the ward outside the nurses so they could smoke out there and then wheel them back in again. So I could never work that one out. When you do habits that are known to be detrimental to your health and you've got no control over those, then there's only one possible outcome for you, and that's living a pretty crappy life when you get a bit older. And it's all your own doing. But if you're not like that, and you're like me and you try and take care of your health, then the chances are the consequences aren't so great when you have an infection, because there's a huge chance for you to overcome this infection in a shorter rather than longer period of time. But let's just say you're a healthy person with a Helicobacter infection who's probably taking a proton pump inhibitor, some kind of acid blocking drug, or Pepto-Bismol or something on a regular basis. And millions of people in America are doing that right as we speak. In Germany, in Holland, in England, in Singapore, in many countries around the world, people are doing it right as we speak. They're taking their medication for their heartburn. They're not paying any attention to the infection. They think that they've got no Helicobacter because the doctor said they're perfectly fine, and they can't find any cause for the heartburn or the inflammation, so they just put them on a drug. Well, the long-term consequences for those people is not so good, unfortunately. I think you can get away with these drugs when you're in your 30s and 40s and 50s, but when you get a bit older, that's when your chickens come home to roost. And why would that be? And that's because your body is getting older. Liver function declines, kidney function declines, immune function declines 1 to 3% per year. Everything's slowly declining. We're all going to die. We know that, but we all want to die slowly. We don't die quickly. So medications long term come at a huge cost to your health. So the point I want to make out of this video is, if you do have a symptom, the consequences are great if you keep taking a drug to suppress the symptom. That's the problem. If you take a drug short term and then get off it, I think it's okay. Try and see drugs really like credit cards, okay? Once you've used them, cut them up and dump them. Flush them down the toilet, get rid of them. Don't keep using it. Would you keep racking up debt on a credit card and not paying it back? You wouldn't do that, but that's what people do with medications all the time. So, don't be a mug and stay on a drug. If you've got a symptom, find the cause and fix it. That's the intelligent approach. And people who start thinking like that have got a much greater chance of not having serious consequences as they age than people who throw caution to the wind, keep drinking wine, whiskey, keep eating potato chips all the time, keep taking drugs. Those are the people that end up with serious health problems down the track. So it's quite a serious video, and I want you to think about that. If you take medications long term, or you've got a partner who takes them long term, or a loved one, or a friend or a family member in exactly this position, it's nice to be able to urge that person to say, look, come on, check this out. It's not good long term. Let's get this problem sorted. Maybe a bit of testing. Let's try and clean up your act, clean up your diet. Those are the intelligent approaches that are going to help that person have a better quality of life as they get older, rather than misery, which a lot of people have when they get to my age, 50s or 60s, they end up with serious digestive problems and crippling pain and more drugs and more medication. It's not really a nice way to grow up, and to spend your latter years in pain and misery. So to answer that question, what are the risk factors if it's left untreated? Well, the risk factors, in my opinion, are slim if you're a healthy person who knows how to look after his or her health. But the risk factors are great if you remain on medication and you throw caution to the wind and don't care about your diet and lifestyle. Then you've got great risk factors. Thanks for tuning in. I'll catch up with me in the next video. The next video we're going to do, how do I prevent from getting H. pylori? Thank you.